Let's talk about the ligaments of the hip joint. So the ligaments of the hip joint act to increase stability. They can be divided into two groups, intercapsular and extracapsular. Let's start with the intercapsular ligament, and this is the ligament of the head of the femur, also known as the ligamentum teres. It's a slender ligamentous structure in the hip joint. While its functional role has been debated, recent findings indicate it may have more significance than previously thought. This ligament arises from the acetabular notch connecting the fovea of the femoral head to the depths of the acetabulum. Now, it's a potential stabilizer. Its role in hip stability was considered minimal. However, recent studies have suggested it may provide some constraint, especially in certain hip positions. It houses an artery that contributes to the blood supply of the femoral head, particularly during the early developmental years. Now, emerging research indicates that the ligamentum teres may play a role in proprioceptive feedback for the hip joint, influencing joint positioning and movement coordination. There are three main extracapsular ligaments, continuous with the outer surface of the hip joint capsule. So let's talk about the iliofemoral ligament. This is often referred to as the Y ligament. It's one of the primary ligaments stabilizing the hip joint. It is well known for its strength, making it an important component within hip joint stability. The ligament spans from the anterior inferior iliac spine and the acetabular rim of the ilium to the intertrochanteric line of the femur. Now, its function is stabilization. The primary role of the iliofemoral ligament is to resist excessive extension and maintain hip joint stability, ensuring the head of the femur remains deeply seated within the acetabulum. In the standing position, the ligament becomes taut, aiding in keeping the pelvis and trunk erect without the need for significant muscular effort. Beyond restricting hyperextension, the ligament also assists in limiting external rotation and adduction (ADD) of the hip. Now, what is its clinical significance? The iliofemoral ligament's robust nature and critical positioning in the anterior hip makes it clinically significant in various scenarios. As a primary stabilizer of the hip joint, damage or laxity to this ligament can result in anterior hip instability, predisposing individuals to dislocations, especially during traumatic incidents. Its tightness can restrict hip flexion, external rotation, and adduction, potentially contributing to conditions like anterior hip impingement. So let's look at the pubofemoral ligament. Now, this ligament stretches from the anterior and inferior aspects of the pubic bone to the femur. Now, the function of this ligament. Now, this ligament aids in bolstering the anterior aspect of the hip joint, thus providing added stability. Its primary function is to restrict excessive abduction, ABD, and external rotation of the hip, ensuring controlled movements within physiological limits. Now, the clinical significance of this ligament. It lies in its contribution to hip joint stability and its potential involvement in hip dysfunctions, as it reinforces the anterior and inferior parts of the hip joint capsule. Injuries or laxity to the pubofemoral ligament can compromise anterior hip stability. Now, the ischiofemoral ligament is one of the lesser discussed yet vital ligaments contributing to the stabilization of the hip joint. It plays an important role in restricting certain hip movements, aiding in the joint's overall stability. While it's not as robust as the iliofemoral ligament, the ischiofemoral ligament plays a critical role in posterior stabilization of the hip joint. It restricts excess internal rotation of the hip. Additionally, it aids in limiting hip adduction, ADD, and extension.